onto his face, just missed his eye. And this is 5 weeks after the final treatment. Again, treated for 8 times, twice a week for 4 weeks. This was Omnilux, this was not Healite, but Healite would get similar if not better result. And the nice thing is no secondary hyperpigmentation and really nice skin formation. We move on to a much more serious burn. This is an electrician who was working on a high tension line, and he got high tension flash burn. It has flayed the epidermis almost totally off his dermis and given him some really deep second degree burns. So because of the seriousness and the size of the area, he received 2 4-week treatments with a 4-week interval. And there's the result 16 weeks after baseline. Now he still needs a lower blepharoplasty, but Healite can't do everything. However, his wife was delighted because she said he looked so much younger after his burning. So I don't know if that means he has to go and burn himself every 5 years. This is a different kind of burn. This is a fully controlled second degree burn of a lady who has undergone full face laser resurfacing with erbium YAG and carbon dioxide laser. And this is typical of the findings 72 hours after treatment. And this is why full face resurfacing kind of dropped out of favor because people didn't really like going around like that. But when we applied 830 to the other side of her face, that's new skin. Right? You can see it connecting to the area that was protected with the eye cup. No new skin this side. Lots of crusting and yucky looking and exudate. And then when we look at 6 weeks after the operation, this was the side without LED. You can see that it's still red and still scabbing, and this side is almost normal. So she was delighted. We had to treat, of course, the other side. So this is the problem with controlled trials. Sometimes you really need to treat the patient twice. So it's not a magic wand. You know, LED plus full face resurfacing can't turn that into that. More's the pity. But it can get this result. Wow. And that's 5 weeks after the operation. No sign of erythema, really nice wrinkle control. It really means that full face ablative resurfacing is the gold standard for skin rejuvenation. Right? But there are side effects. So we did a little study and we compared 60 patients, 30 with LED, 30 without. Wound healing, better than half. Pain, erythema, bruising, and edema significantly reduced with LED therapy. And this applies also to surgery, any kind of surgery. This is bruising. This is a 61-year-old male after full hip replacement surgery on the right hip. Terrible hematoma. And this was actually treated with 633 Omnilux 2 weeks after 3 LED sessions, 2 days apart. And you can see that wonderful resolution of the bruising. And we know why. It's PGI2 alpha is increased, and it's an anti-aggregant. It stops clotting. It helps dissipate bruising. And I know this person very well. This was me in 2008 when I had my right hip replaced. Some of you will remember that. Yes.
While you're showing those pictures, I've got to say, when I first got my first Omnilux nearly 10 years ago, my darling husband actually was on a hit and run. And I've got to tell you, whilst you don't have those pictures, yeah, I was very convinced about what LED could do. So once he was out of hospital, because he had total regrafting of the side of his face as well as the head above the brow, and twice a week on the red, and for about 4 to 6 weeks. If you saw him today, the most he's got is a little bit of pigmentation loss.
Very nice.
No scarring, nothing.
Yep.
So I can certainly vouch for everything.
Yep. And let's not knock 633. The 633 wavelength is very good for wound healing, but the 830 is better and faster because of the cells that it particularly targets. But this was 633. This anti-bruising was 633. So we can use Healite on its own, but it's much, much, much more interesting if we combine it with something else. It doesn't matter what you do, as severe as surgery to as gentle as a powder peel, or creams, or any kind of topicals. You combine it with 830 nanometers, you will get a superior result and a happier patient. And I mean, some of these we've covered already. Bone fracture, non-healing ulcers. Now that's an important one, especially for the likes of diabetic ulcers and diabetic foot. The improved blood flow is clinically proven. The arthritis treatment is also clinically proven, as is muscle pain and sports injuries. So I don't think that Healite is only a new concept. I think it's a brand new concept in phototherapy. And I'd like to thank you very much indeed for your attention. Thank you.